we all know, last month was October. It was also Breast Cancer Awareness Month, so I chose to do my speech over breast cancer. Every person should know the signs or symptoms of breast cancer. At any time an abnormality is discovered, it should be investigated by a healthcare professional. Most people who have breast cancer symptoms will initially notice one or two, and the presence of these symptoms and signs do not automatically mean that you have breast cancer. By performing monthly breast exams, you will be able to more easily identify any changes in your breast. According to cancer.gov, age and health history can affect the risk of developing cancer. Older age, menstruating at an early age, a personal history of breast cancer, a mother or sister with breast cancer, treatment with radiation therapy to the breast tissue that is dense on a mammogram, taking hormones such as estrogen and progesterone, drinking alcoholic beverages, and being white. Breast cancer is sometimes caused by inherited gene mutations. Women who have mutated genes related to breast cancer and who have had breast cancer in one breast have an increased risk of developing breast cancer in the other. These women also have an increased risk of ovarian cancer and may have an increased risk of other cancers as well. Men who have a mutated gene related to breast cancer also have an increased risk for the disease. There are tests that can detect or find mutated genes. These are breast screening centers, breast cancer prevention, genetics of breast and ovarian cancer. The possible signs of breast cancer include a lump or change in the breast, a lump or thickening in or near the breast or in the underarm, a change in the size or shape of the breast, a dimple or puckering in the skin of the breast, a nipple turned inward into the breast, fluid other than breast milk from the nipple, especially if it is bloody, scaly, red, or swollen skin on the breast, nipple, or areola, dimples in the breast that look like the skin of an orange. There are tests that can determine or diagnose for breast cancer. These include physical exams, clinical breast exams, mammograms, ultrasound, MRI, blood chemistry tests, and a biopsy. I found some statistics for breast cancer at www.komen.org. It says in 2012, it is estimated that among U.S. women there will be 226,870 new cases of breast cancer. These will result in 39,510 deaths. Rate of breast cancer among women vary by age, the race or ethnicity, being African American, Jewish, Asian American, Pacific Islander, Hispanic, Latina, American Indian, or Alaskan Native. Also, specific populations such as lesbians, gays, bisexuals, transgender people, or pregnant women. Breast cancer in men is rare, but it does happen. In 2012, it is estimated that among U.S. there will be 2,190 new cases of breast cancer in men and 410 breast cancer deaths. Survival rates for men are about the same as they are for women. The treatment for men is also the same. It usually includes a combination of surgery, radiation, chemotherapy, hormone therapy, and targeted therapy. Decisions for the best treatment are based on the results of these tests, which could be how quickly the cancer may grow, how likely it is that the cancer will spread through the body, how well certain treatments might work, how likely the cancer is to reoccur. Certain factors that affect the treatment options are the stage of the cancer, like how far along are you, the types of breast cancer, estrogen receptors and progesterone receptors level in the tumor tissue, how fast the tumor is growing, how likely it is to reoccur, a woman's age, health, and menopausal status also affects the treatment options. Whether the cancer has just been diagnosed or has reoccurred before also affects the treatment options.